So, as way of background in prostate cancer in America, African American men are not only at higher risk for developing prostate cancer, they're at much higher risk for dying from prostate cancer. In fact, they die 2.5 times greater likelihood of death from prostate cancer than Caucasian men, and 5 times greater likelihood of dying from prostate cancer than Asian American men. So we suspect there's a genetic component to this. Now, there may also be access to care and other issues, but we think there's a genetic component as well. And when we look at our clinical trials in advanced prostate cancer, particularly this drug abiraterone in the Cougar 302 study, African American men were very, very underrepresented. In fact, because it's a global study, only 2.6% of men were African American. And when you look at it, that's 28 men out of a study of 1,100. What was interesting to us was in that 28 men, when we looked at 15 of them had gotten abiraterone, they actually did better. They had a higher response rate and a longer response by PSA to abiraterone than the rest of the population. But it was 15 men. It was a tiny population of patients. So we looked retrospectively at our own series at Duke, and we did a nested case control, 2-to-1, whites versus blacks, and we controlled for prior chemotherapy. And guess what we saw? Exactly the same pattern, a higher PSA response rate, a longer time to PSA progression in the African American men versus the white men. So we wanted to do a prospective study. And so we started at Duke as a prospective study. We made it a multi-center parallel group study of 100 patients, 50 African Americans, 50 Caucasians, to just explore what are the differences in outcome associated with race on the same treatment at the same centers.